to Bariatric Friday with United TV. My name is Kamal Erkan, and we are going to have another important topic for morbid obesity and fighting morbid obesity. And Dr. Aizaz Irga is going to join me for today's session, as usual. So we are going to dive into our topic today. We are going to discuss the better understanding of social stigma and the sexual health for those who are fighting with morbid obesity. This could be any of our patients who are already in the program, but anyone out there who is struggling with the morbid obesity, and this is impacting everyone. So we are hoping that we can make this available for those, and it can be a good source for everyone. Now, Dr. Ga, how are you doing?
I'm doing great, Kamal. Wonderful to be on yet another session of Bariatric Friday.
Thank you for coming again. So I know you have a busy schedule this week, and you are going to go and do maybe another surgery after this.
Yes, I am.
You have another meeting later on, so it's a busy day. So we want to start with the question on, that stigma, social stigma is one of the really big impact on those who are dealing with morbid obesity, and this is people being judgmental and not understanding disease itself, and a lot of people who deal with depression, anxiety, and not looking for solutions. So how does social stigma affect people living with obesity, particularly in terms of mental health and willingness to seek treatments? So how does social stigma affect people living with obesity, and particularly in terms of their mental health and willingness to seek treatment?
Social stigma can severely damage confidence of patients and also their mental health. Many individuals may feel that they are being blamed for their condition, and this can lead to internalization of the judgment that is being applied to them by the society, and therefore they may feel isolated, and that can lead certainly to issues like depression and most importantly avoidance of medical care. It's not uncommon for us to see in our practice, for instance, patients who have delayed medical care for a very long period of time for fear of being judged. So this can create a vicious cycle, right, where you are feeling stigmatized.
Mm-hmm.
It's worsening your mental health, which by itself can worsen obesity, right? A vicious cycle downwards that definitely can get patients to much worse situations before they can get care.
Mm-hmm. So we want to actually, another segment of this is to see this from the role of the healthcare system itself. And unfortunately, healthcare professionals are not immune from these stigma-related issues, and there is an implicit bias out there. Not everyone is going to process these at the same level. So in terms of the healthcare providers, what can healthcare providers and system can do to reduce the stigma and bias when caring for patients with morbid obesity?
Clearly, education. First and foremost, to recognize that obesity is a disease. Many people actually may not realize, Kamal, that it's only been about 10 years or so since the American Medical Association recognized obesity as a disease.
About 15 years, 2010.
Right?
Yeah.
And that is not a very long period of time if you think about it. Previously, we were looking at it more like a risk factor for diseases, not a disease itself,
Mm-hmm.
which means that there was a lot of emphasis in what the patient was doing or was not doing with regards to obesity. And that was putting obesity really in an unfair situation, because it means we've lost a lot of time in which we haven't done appropriate research, looked for proper treatments, looked at insurance companies to cover properly treatment for this condition, right? So clearly the healthcare profession has lagged behind. it's actually interesting when you think about it, Kamal, because there are other diseases that are directly related to lifestyle. Take lung cancer, for instance, right? The vast majority of lung cancer is caused by smoking, right? And yet we didn't shy
Blame
away
the
from
people, right?
recognizing lung cancer as a disease, or we don't turn people away because they have lung cancer, right? Lung cancer is definitely related to this lifestyle issue. And then the other interesting thing is that if you stop smoking, the risk for lung cancer goes down immediately, precipitously, right?
Hmm.
But if you change your diet, obesity is still there. It's a very hard thing to take care of, right? So recognizing it not only as a disease, but as a complex disease that has many, many factors interacting, including genetic factors, environmental factors, hormonal factors that are affecting it, is very important. Because once you take the blame away from the patient and you focus on the disease, then you can provide appropriate treatment. This is important. And so not only is important for us as healthcare workers to recognize that it's a disease, but also take away that judgmental view as well. Use appropriate language when we are talking about obesity. Provide a very receptive, accommodating environment. And then also show empathy, about the suffering that the patients are going through because of obesity.
So the stigma sometimes becomes a problem, even if the healthcare providers, physicians to approach the patient in the exam room when they are there for a different problem, and then like patient with BMI 54 is in the exam room, and when I see in some cases, well, let's see if the obesity was discussed, and well, there's nothing. Well, in today's uh, medicine, we have prescriptions available if they don't want to do surgery, and there has to be a treatment, right? So we cannot have a patient with 54 BMI and not to like I see like there are three medications for diabetes. There's four cardio medication, and then there's nothing done for morbid obesity. Well, how is that gonna actually help the patient if you don't really address one of the main root of these problems, which is the morbid obesity?
And that's where using the appropriate language, having a receptive environment, and also showing empathy is important, right? Just ignoring the problem doesn't help the patient, right? Of course, you also have to be sensitive to the fact that patients already feel stigmatized, and it may be an issue that they don't feel comfortable discussing openly. But there are ways of approaching it, You could, for instance, approach the problem by saying, hey, are you comfortable with your current weight, right? Or are you how long have you struggled with weight? Issues that bring about the struggling part rather than the blaming part about it, right? So that patients can start having that conversation, right? And they will then volunteer to you that they've been very unhappy because of their weight and that they're struggling. And that opens up an avenue for you to discuss possible treatments as well.
So, from the personal standpoint, I want my doctor to tell me right up, like just without sugarcoating and without being sensitive. So that's what I think I expect from our providers because we are not there in the exam room to be like that's why we have our sisters and our moms and our dads are not in the picture usually, but um, that's the affection that you need to find in the family comfort. Like I really want like if someone is um, morbidly obese, uh, they should be hearing that directly from their healthcare providers. This is a one-on-one. And you told me one day when I was a little bit on you said it nicely, but hearing it is different than kind of guessing. So, and then we started the intermittent fasting together. And if we didn't do it, the things could be out of control. So, like one of my, I won't mention who he is, but one of my really close relatives, I told him, like, it can happen this way. You cannot be doing this, so you have to change. And he did. Okay.
Absolutely,
So
absolutely.
we just need to hear it. Sometimes it's going to hurt. The truth hurts. So,
Absolutely. I don't think we can shy away from the problem. But I mean, medicine is also an art, as you know. So obviously, understanding the personality of the individual you're dealing with and then finding the best way to reach to them is very important, right? Sometimes a confrontational approach may work, sometimes it may backfire, right? Depending on who the patient is. The key, though, is that we cannot shy away from that issue. As you correctly said, if you're seeing a patient whose body mass index is 54, no matter what their current complaint is, as a physician, you should bring about the issue of weight. Again, not in a blaming way or stigmatizing way, but make sure you make a connection to their health condition, because I cannot imagine that there is any disease that is not directly affected by the person's weight if the person is suffering from morbid obesity.
So, since today's topic is going to be with stigma and the sexual health part of it, um, as a lot of other things, morbid obesity impacting people's sex lives as well. And the sex is something that is a balancing act for our bodies, and men, women, they need to have these satisfactions. And this is not just the physical satisfaction, but this impacts a lot of things, from the hormonal imbalance, the fatigue, and even the self-image, the poor self-image issue. And then what people start doing is they are kind of putting strains on intimacy, and they are not really making themselves available for either their partners, for just even finding someone. And this is usually is not being talked. And you and I, we started putting this on one of our main topics for the last several years, and we get questions on these from our patients. So, can you explain how obesity affects sexual health and what changes patients might experience after bariatric surgery?
Absolutely. A key factor in sexual health really is hormonal balance. And obesity can bring about an imbalance in the hormonal environment. Specifically, obesity can lower the levels of testosterone in men and levels of estrogen in women. And that can directly affect energy levels, it can affect sexual desire. And if to that you add the lack of self-esteem that a person may have because of obesity, or dissatisfaction with their body image, then that can lead to a really disastrous sexual life, essentially. So it's not surprising that many patients with obesity also will express dissatisfaction with their sexual life, right? And you see the opposite after bariatric surgery, for instance. After bariatric surgery, you will see patients expressing a high level of confidence. You will see them having much better energy, and also their hormonal balance is in a much better place, therefore improving their sexual health as a whole. And as you correctly said, this is actually something that's not discussed very often, but it's actually one of the areas where treatment of obesity can bring about great benefits.
Absolutely. Now, after significant weight loss, many bariatric patients experience changes in their relationships, and some of them are ready for those, some of them are not. I know our patients are getting a lot of good support and educations from our activities, and they are up to date. But now this changes the dynamics in these relationships. There are new tensions and new maybe dynamics shift. And with all these, what are some common experience patients are reporting about the intimacy and relationship dynamics after the surgery?
Clearly, for some patients, really being liberated from obesity brings about a renewed passion and renewed emotional connection with their partners. Therefore, it's all positive. For others, there may be challenges. There may be challenges, for instance, related to the fact that the new version of that person's body after bariatric surgery may bring about insecurity or other perspectives in their loved one. These are issues that have to be discussed, and clearly one of the reasons we have extensive preparation before bariatric surgery is to be able to discuss all this. Open communication is very important. In some cases, counseling may be relevant, and as we've said in many of our sessions, support groups are also important. Support groups are situations where patients will be able to relate their own experiences, either positive or negative, to either encourage others or seek solutions from others. Very important.
Absolutely. Now, I want to just take a little detour on this, what we started at the beginning. I shared something with you yesterday from one of the research studies that we are doing. There are a couple of them happening. One is with our high hospital utilization for our accountable care side. And the other one is with patients who are on GLP-1. And last week or the week before, we had a session with Dr. Peters. 2 months ago, we had a session with Dr. Gail Wynn. And 2 weeks from now, we are going to recover that with Dr. Rosing with the weight loss medication. And part of the issue with this one is that I wanted to actually kind of point out how difficult and why it's how complex the morbid obesity is. And one of the patients started with 345, and I believe Ethan is going to bring that up on the screen for me. And they went down to 225 with medication, and then now they are back at 300s. So right now I'm sharing that on the screen. So if you remember that. It's going down and going up again. So this is what we have seen, and this is why in some cases the solution, even every solution is not going to be the same, but I can see how disappointing for this it would be for this patient to go down to 225 and then all of a sudden boom at 300 again. So this is kind of explaining these issues that we have with the understanding the chronic illness, if this is a problem or not. So there is no way, whatever they see right now on the screen, and if you want to just remember that picture, Dr. You can just look at that screen right there.
Yeah.
So it's, like this was my number one patient.
Yep.
And then we were just doing data validation for the 12 months. And I told Zoe, who's helping me with this project, I was just showing her some of them. This was the first patient.
Yeah.
And we're like, oh, this is great. So patient lost, and then not really. So they lost and then they gained it back. But this is the complexity of this problem.
Absolutely.
That we are dealing with. And,
Absolutely.
And I know we are going to talk about this more, but I just wanted to put that out there for people to make some references. So the shame, identity, and empowerment, these are all happening at the same time when big changes are happening. Many individuals define their self-worth based on their appearance and the others, and then others' judgments. So bariatric surgery is the turning point for these individuals, and not just for the physical side of it, but emotionally, this is a huge takeover milestone. How do you help patients move beyond shame and develop the healthier identity after bariatric surgery?
Absolutely. I mean, it is very important for patients to look at themselves beyond their weight. Of course, losing the weight is very important, but also we emphasize many victories really that they are achieving that may not be necessarily related to just seeing what's happening on the scale, essentially, right? Objective changes in their daily life, which may not seem much to somebody who hasn't suffered from morbid obesity, but for somebody who struggled with morbid obesity and now they are able to run without having any pain, right? Or they are able to sit comfortably on a seat in an airplane without struggling, or they are able to take their kids or grandkids to Disney World and ride with them without any problem. These are extremely important aspects of the successes that they are having, and that somehow also resets how they see themselves in the world, but also how the world might be seeing them. So the shame issue is very often related not just because of what they see on the scale, but also on the shortcomings in their daily life that come about because of obesity. Once they overcome this, then they are able to liberate themselves from these feelings of shame or being judged as well.
And if they need any, help, and this would be the time for them to actually just start looking at like some professional support. And the changes big, so it's not like me losing 10 pounds.
Absolutely, absolutely.
100 pounds is gone, and that comes with its own physical and psychological changes. And but it's a good challenge to have. So because otherwise, the alternative is not great for our patients. Now, the early puberty in girls with obesity is another issue, which is probably one of the maybe biggest potential issue that I see for our population in the future. So, childhood obesity linked to earlier onset of puberty, and the food being available, readily available, not doing enough activities, things can accelerate. So, how does obesity contribute to early puberty in girls, and what are the long-term physical and emotional consequences?
So, fat tissue is actually fairly active from an hormonal point of view, and it can increase estrogen levels, right? And in young girls who are suffering from obesity, there may be excess estrogen being produced very early, and that can trigger the onset of puberty earlier than their peers. And that will have consequences, right? Because they may feel that they're out of place. At that young age, they may be, attracting unwanted attention, and they may feel ashamed, right? And this can lead to long-term problems, not only in terms of their mental health, but also in their reproductive health in the long term. So it is really very important to address obesity early in childhood as well, not least because of these problems, particularly in young girls.
And my next and for today's session, my final question for our episode is the morbid obesity and menopause. And this is the other side of the sexual health. And when we say sexual well-being, most people think just the sexual intercourse. But what we are talking about is everything that happens with our bodies. And you and I, we may not relate to this as much as like when I did this with Dr. Wynn, I tried to stay out of the question or the topic discussion. So just let her do what she needed to say. But the menopause is a really big problem by itself already. So when we have morbid obesity, this is actually making things even much harder for those. So how does obesity affect menopausal symptoms and sexual health, and what patients can expect after bariatric surgery?
So clearly, there is an interplay between the two factors, right? Obesity itself can intensify the symptoms of menopause, but menopause itself can make it a lot harder for women to try to lose weight. Essentially, once they reach that level, they may find that they're gaining weight much more rapidly and having a really hard time controlling it as well. But obesity itself does affect negatively, the symptoms of menopause. So whether it's hot flashes, whether it's fatigue, mood swings, vaginal dryness, decreased libido, all these things can be affected. And if you add to that the fact that there is a lack of self-confidence related to body image because of obesity, then you can see that their sexual health is going to take a big hit as well. Of course, bariatric surgery can really have a big impact here because not only it improves the metabolic health, but it can improve the hormonal balance as well, leading to lessening of the symptoms of menopause, but also women can feel much more energized and they can feel much more self-confident. So although menopause by itself may be an inevitable stage, hormonal stage, its effects can be minimized if there is no obesity around. So obesity worsens the symptoms. The menopause itself can make obesity a lot harder to deal with or worsen obesity. And breaking this cycle with bariatric surgery can bring about tremendous changes.
And I think that the onset of menopause, I don't know if I missed that, but that has some impact, right? So
Absolutely, it can be an earlier onset,
So,
onset of menopause. Yeah.
and for that specific one, when we cover this topic, I had a session with Dr. Gelvin, and for those who are watching us, they can actually go to the playlist for this specific topic. There are several other episodes that we discuss this. That's what I have for you guys for today, Dr. Gav, for you and for our people, of course.
Thank you.
So,
We've covered a lot.
We try to cover a lot, and this is again one of those new formats that we want to have for this cycle. And the issues are there, but the solution is available. So we want our patients to look for what's best for them, and they don't have to be our patients. So anyone who are dealing with these issues, and I know there are a lot of people out there who are dealing with these issues, we want to make these things available so that they can watch and get the help that they need. So this was a powerful discussion, conversation, answers that we got from you, Dr. Gaut. Thank you for that, and we are hoping that we can contribute to society for people to better understand morbid obesity and what people, family members, friends, physicians, healthcare providers, what their role is and how they can help to fight morbid obesity. So that's all we have for today, and we'll be back next week. Until next week, stay united. Bye-bye.
Stay united. Thank you.